clock, so let's count it down. 3, 2, 1. Good evening, Somerville. I'm Joe Curtatone. I have the honor and privilege of being the mayor of this incredible city. I want to welcome you all for tuning in to tonight's virtual town hall. The type of meeting, trust me, I'd much rather do in person than our typical Resistat or neighborhood meetings. But obviously, given the circumstances of the crisis, we're relegated to doing this through a lens, but at least we have this opportunity to try to engage you. Tonight's meeting is all about engaging you, sharing data and information with you, and trying to answer all the questions. Before we kick off and I introduce the panelists this evening, I first my sincerest thanks and appreciation to all of you for stepping up, doing what you've all done to pitch in and help us out as a community to overcome the COVID-19 crisis. This health emergency has turned our lives upside down. It has brought our economy to its knees, and it's imposed an incredible amount of mental and emotional duress on all of us because of the isolation of the situation. These are uncertain times, they're volatile times. And while we've done a lot to, and I'll thank you more later about flattening the curve and overcoming the surge, we have a long way to go. To date, as I speak to you, 23 souls have been lost. 23 members of our community have passed and succumbed to the virus that we know of. 808 people have tested positive. Those 808 people we know have the virus, have the disease, and 589 have recovered. Without all your efforts and help and assistance, many more people would fall ill, many more people would have died. I thank you for all that you've done. We've got a long way to go, and we will overcome this and get to the other side of this thing together. So I'm going to do my best tonight, along with the panelists, to provide as much information as possible in terms of what we're doing to respond to the COVID-19 crisis, as well as our approach to reopening in light of the governor's announcement yesterday. And this will be the first of many opportunities we have to talk with one another. So once again, welcome. And if you have questions, please submit them to the Q&A function on your Zoom app or your Zoom, to the Zoom portal. And we do have a series of questions from people that were submitted in advance. And we'll take questions at the end of all the panelists' presentations. So let's get going. That's not going. So let me introduce our panelists tonight. Omar Bukili is the incident commander for the COVID-19 response team. Omar, say hello.
Thank you, Mayor.
Sure.
Sorry about that. I think I was muted. Thank you, Mayor. So good evening, all. Thank you for being here tonight. Like the mayor said, I have the honor and privilege of serving as part of the COVID-19 response team in Somerville as the incident commander. I just wanted to echo the mayor's comments and thank you very much for what you've been able to do and for your ability to ensure that your community, your neighbors, and your loved ones are safe and help us deal with this exceptional challenge.
Next is Tom Galligani. Tom is the Director of Economic Development. Tom?
Greetings. Good to join you here this evening, Mayor, and for the rest of the stakeholders here in Somerville. I work with a team of economic development professionals out of the Office of Strategic Planning and Community Development, and I'm also, as part of the Incident Command Center structure, I'm the business liaison. So glad to join you this evening.
Thanks, Tom. And next is Doug Quest. Doug is the Director of Health and Human Services for the City of Somerville. Good evening, Doug.
Good evening, Mayor. Thank you for inviting us all to join you tonight on the town hall meeting. We do appreciate getting this information out. And I want to echo your comments of thanking the community to help us keep our curve flat and flatten that curve. It's really an important piece to keep everybody healthy in our community, and a great opportunity to share what we've done and where we're moving forward. I get to lead a great team of people who work on all aspects of this COVID-19 response, from food to our senior population, to our social workers, and a variety of others. So, of course, we also have our nurses who are doing a lot of the work, investigating and following and doing our community tracking. So thank you for having us.
Thanks, Doug. Next is Jill Lathan. Jill's the Operations Section Chief of the COVID-19 Incident Command System and the Director of Parks and Recreation. Jill?
Hi, it's Jill Lathan. Glad to be here tonight. It's been a wonderful opportunity to serve the city of Somerville as the Operations Section Chief, kind of help work with other departments, ensuring that our residents have what we need to get through this pandemic. And also the Parks and Recreation Director, just kind of moving forward, seeing how we're going to come out on the other end of this stronger and better than ever. So thanks for having me tonight.
Thanks, Jill. Next, he's no stranger to many of you in the Resistat meetings and other meetings, Brad Rawson, the Director of Mobility. Brad.
Good evening, Mr. Mayor, and good evening, neighbors. My name is Brad Rawson. I serve our great city as Director of Mobility within the Mayor's office. The team that I lead is responsible for everything from safe walkable streets to transit coordination and building the MBTA Green Line extension. As many of you know, I'm a Somerville resident, Somerville parent, and like so many of you, I'm now a solo stay-at-home caregiver because my spouse is on the front lines at serving our community every day. So sending you my greetings in regards to you and your family.
Thanks, Brad. I want to introduce Ms. Ellen Schachter, the Director of the Office of Housing Stability. Ellen, good evening.
Thank you, Mayor, and hi, Somerville residents. My name is Ellen Schachter, and I'm the Director of the Somerville Office of Housing Stability. Please know the Office of Housing Stability is here to serve you during this pandemic and always on any issues that relate to housing instability. This is true for we can help tenants, homeowners, and landlords. So please reach out. You'll hear more about our services tonight.
And I want to introduce now, thank you, Ellen, Ms. Luciana Quintanilla. She's a social worker and family services manager for the city. Luciana?
Thank you, Mr. Mayor. Good evening, Somerville, neighbors, dear residents. I am Luciana Quintanilla, the social worker at the Health and Human Services Department, and I am here with you tonight to help you learn more about services and resources that you can be connected to. Thank you.
Thank you, Luciana. And I also want to recognize we are joined once again, and we have assisted two people helping us with American Sign Language interpretation, Ms. Kerry McSwain and Ms. Sherry Kuhn. I want to welcome them both and thank them for helping us out tonight and communicating with our residents. So we have a lot to present to you, the community this evening, but first, I want to, for an announcement, an important update on our census, approach to our census is Ms. Meredith Gamble. She's the complete count census coordinator for the city. I want to welcome Meredith for an update to the community. Meredith?
Good evening, everyone. If you don't just mind advancing the slide. Thank you. Just a quick announcement about the 2020 U.S. Census. The U.S. Census is a really easy way that everybody in our community can support our community right now. The census has a lot to do with what's happening right now with the coronavirus response, because it determines all the funding that our city and our state gets for things like hospitals and healthcare, emergency preparedness, public schools, transportation, infrastructure, all of those things tie into the census. So having a complete count for this decennial census is extremely important to making sure that Somerville has all of the resources that we'll need for the next 10 years. It's really easy to complete. You can go online to my2020census.gov or call the census number 844-330-2020, and it takes about 10 to 15 minutes to complete. You'll count everybody who lives in your household, including roommates and children or anyone who's living with you temporarily. It's also really important to complete the census now, because starting in August, census workers from the U.S. Census Bureau will be coming out to our communities and knocking on doors to encourage folks to complete the census if they have not done so already. So if you can complete your census as soon as possible, that's going to help keep our community safer as well. Thank you very much, and thank you for being here.
Thanks, Meredith. So once again, I want to thank everyone in the community for all that you've done. We've often said, and you've heard the phrase, we're all in this together, and we're only going to overcome the crisis together. And your efforts, again, deserve much praise and thanks. We know, and I'm acutely aware of the hardships this has imposed on so many in our community, as individuals, as families, as essential workers, as small businesses. Those sacrifices have paid off. When we initially faced this crisis, you heard about the surge and the flattening of the curve. The goal was to do everything we could to ensure that our healthcare system would not break down and that we would consequently be faced with moral dilemmas in our hospital wards like we saw in Italy. Italy, and Northern Italy in particular, is the second best healthcare system in Europe, yet they were faced with unconscionable decisions to make: who to treat, who to give an ICU bed or a ventilator. In fact, they made a decision not to treat anyone 80 years or older. And we saw dozens, more than 60 frontline workers, nurses, doctors who succumbed to the virus themselves. That frightening picture drove us in Massachusetts, in cities and towns across the Commonwealth and across the nation to act quickly and deliberately. And I'm proud to have served with so many great local leaders from cities and towns, large and small, to one, unilaterally begin closing school districts and really advocate and force the administration in the Commonwealth to finally close. Two, to issue stay-at-home advisories and orders and other measures necessary to ensure social distancing and interrupt the transmission of the virus from person to person. Eventually, the Commonwealth did the same. All that work, all that pain, all that sacrifice has resulted in the curve flattening. But I want to caution all of us. We are not declaring victory here. We have a long way to go. This is a disease that will live with us, and we have to live with for years. We are now not preparing for reopening, but preparing for the resurgence. But I do want to share some data that we have, and then we'll answer some specific questions at the end. To date, as of 5:40 this evening, as I mentioned earlier, we have a little over 800 confirmed cases of COVID-19 in the city of Somerville. That's confirmed. This does not represent anyone who's actually carrying the virus or who is ill. 589 of those who've been confirmed have recovered, and sadly, we now have 23 fatalities, 23 beloved members of our community, neighbors, friends, family, who we have lost. It's important to remember that these cases here outlined in this graph, and the orange bars represent the number of new cases, and the blue line represent the total number of cases, the cumulative number of cases. It's important to remember that these cases likely represent only a fraction of the total cases. We still do not know the total number of people who died or become ill as a result of COVID. As we've gone through the last several weeks, more and more reports have come out about statistics that signs of people with pneumonia-like symptoms and deaths as a result of those cases appeared earlier than originally thought. But this sort of represents the distribution curve of the many charts you've seen on many news outlets, by presentations by many leaders at the national, state, and local level. So this is where we are as of today, a snapshot of where we are as of today in Somerville. In Massachusetts, a similar graph paints a snapshot of where we are in the Commonwealth. Again, this does not represent the total number of cases of people infected with COVID-19 or deaths. So the blue bars, again, are the new cases by date, and the blue line is the trend of the cumulative cases. Now, there's other important information and graphs that need to be shared with the public that myself and local leaders continue to advocate and fight for with the administration. And I will say a couple of things to keep in mind. While it's important that we see the number of positive cases decline, it's also important to remember that deaths and the number of deaths will lag behind the number of positive cases. And the number of positive cases typically are a snapshot of what happened 2 weeks ago. The number of hospitalization or the number of ICU beds occupied or available is an important trigger and trend that the Commonwealth, the governor, and his COVID-19 team are examining. They have not, in any transparent way, shared that with us as local and regional leaders or as the Commonwealth as a whole. That's really important because what has been represented to me and others, that the triggers of whether we move forward with the reopening plan as a Commonwealth that the governor has presented or roll back or take other affirmative action will depend really on the capacity of our healthcare system. That shouldn't come as a shock because we've heard that before as we were preparing for the surge to maintain the stability of that healthcare system. So that's just some information I want to present to you now. I'm sure you'll have some more questions. But as we move forward, and as depending on the triggers that the governor and his team will rely upon in making decisions, what I have advocated along with other local and regional leaders in here in Somerville, how we will proceed must be based on the principles stated here. It must be grounded in science and the expertise that guides us. It must be coordinated and regional. It must be equitable. And because we must remember that if anything, this crisis has taught us some lessons. That the economy does not work for everyone. It's certainly made that even more glaringly obvious if we didn't know it already. That the healthcare system, again, there should be no shocker, but it's certainly exacerbated the point that it is failing for most people. And that the people who become the sickest, the people who are dying at a higher rate are the most vulnerable in our communities and our states and our cities and towns. Vulnerable populations, our minority populations, Black, brown people, immigrants, and our elderly. We cannot forget that. And as we move forward, we may keep that equity at the forefront of our compass. And our approach must prioritize health and welfare first. Our goal, our guiding stars in thinking about reopening here in Somerville, and if we press the Commonwealth to embrace, is health, well-being, ensuring the health and safety of people first, and sustainable recovery along with that. This is not a choice between public health and the economy. That is a false and really unethical narrative. Our economy will not thrive if the health of everyone, and I mean everyone, no matter who you are, or how you're situated, what your status is, socioeconomically, will not thrive if the health of everyone is not protected. By moving cautiously and deliberately now, what we aim to prevent are further closures and more damage to our economy in the long term. We know we are going to be faced with a resurgence. There will be a part 2 and a part 3 and so forth to this virus as we live with it for years. And we must make sure we continue to make the necessary policy decisions and individually own the responsibility of our actions to interrupt further transmission of the virus and to make sure the resurgence doesn't reach a level that it reached even now or worse, because people are going to continue to get sick no matter what. People are going to continue to die. And if we don't take those steps moving forward, our economy will tank further than it is now, if you can imagine it. But again, the pandemic has certainly revealed systems of inequalities that must be corrected moving forward. Here's an opportunity for us as a society to take this sacrifice and bloodshed to pivot on these points as we move forward, taking on this healthcare crisis and understanding how we live life on the other side of it. So you heard yesterday that the governor's reopening advisory board has advised the governor, and he's made decisions and announcements in terms of what will be reopening in the first of 4 phases. In general, you heard what those areas represent around construction and manufacturing. This is the governor's of Commonwealth. I'll talk about Somerville in a second. Houses of worship, certain restrictions there, certain personal services such as car washes and hair salons and barbershops and pet grooming. You can learn more about the state's reopening plan and downloaded it from the website here at mass.gov/reopening. But it's up to each individual municipality to digest, to analyze, and apply what they believe they can apply in a safe well-informed manner that ensures the health and safety of everyone and ensures sustainable recovery for our local economy. This is not about, again, planning for recovery, it's planning for living with a resurgence. And our approach all along has been about creating a plan, not a date to start reopening. Now that the Commonwealth has started that reopening, we must be responsible here in Somerville. We must be bold and decisive and show that same leadership that we did along with many other municipalities at the beginning of the crisis to close schools and certain activities and gatherings, to issue stay-at-home advisories, and we must be as thoughtful and deliberate and slow rolling out the sectors of our lives and economy that we want to activate. So in terms of Somerville, and you can look at our reopening plans at the website on the page here, somervillema.gov/recovery. Our first phase is of non-essential construction has been allowed to resume as of yesterday, May 18th. Those plans are on the website. Not every construction project is activated. We've done certain essential public projects and utility projects, such as the high school, with new enhanced guidelines in place that we'd help formulate along with the Commonwealth and other jurisdictions. Municipal projects like at Somerville Lab, the library. Hospitals and community healthcare centers have resumed certain preventive care visits as of yesterday. And other medical providers will restart services on the 25th in line with the governor's timeline. And curbside retail, and consistent with the governor's timeline, is allowed to start on May 25th. And in the city, we already started today, slow rolling out of street sweeping and other services. But there's still more to come. The sectors of the economy that the governor and the Commonwealth's plan has activated that remain on temporary hold in the city and that we've announced are listed below as we continue to assess, the safety and the ability to implement them in a safe way and in a way that ensures a sustainable recovery. And that is manufacturing, houses of worship, personal services, hair salons, car washes, pet grooming, office spaces, parks and playgrounds. Over the next several days, we're going to evaluate these sectors against the guidelines the Commonwealth and the governor has issued, against our needs and the makeup and demographics and our community, against the level of transmission we see in Somerville. And we're going to do everything, again, guided by the stars of health and safety and sustainable recovery. I'm sure we'll have questions about each of these sectors when we get to the end. I'll be happy to engage in a conversation, but we in general, paid particular focus at the advice and guidance of experts to not open or activate sectors where people who frequent those sectors, such as customers or utilizers, are connected to broad networks of other people. We've been advised by the experts at the highest level who guide the CDC, the WHO, and even the governor's COVID-19 response team is to go slow, to be informed by data and science, to be measured, and to measure our interventions. And that's how we're going to take it. Just one clarification, parks and playgrounds are open for passive use, not organized sports or pickup games. You can visit the city's website on that. A little bit about the city's response to the COVID-19 crisis. Well before we declared emergencies, weeks before in understanding, analyzing, and researching what was occurring in other countries, and as the virus hit the United States, we began to assemble our response, reorganizing our administration's resources to be prepared. Everything we have reorganized has been reorganized to take care of the most pressing needs in the community. Every department is working together to make sure that everyone is kept safe in the community, that no stone goes unturned, and it's all hands on deck. I'm proud, and we should all be proud. We have an incredibly talented workforce that has a passion for a curiosity, a willingness to be abnormal, and not afraid to get outside their comfort zone. Hence why Joe Latham, the Director of Recreation, has such a high level of responsibility in the operations of the COVID-19 response. And there are people throughout the administration who serve you every day who stepped it up and dove right into sectors or operations and never thought they'd have to deal with, all with the goal of ensuring a proper response to the crisis, ensuring that we keep everyone healthy and safe. But here, this graph shows you a little bit about the EOC, the Emergency Operations Center, headed by Omar Boukili and Joe Latham and others, which connects to our public health strategy. We still have to deliver city operations and services, even though some of them have been somewhat curtailed back. We still have services every day we have to deliver on public health, on public safety, public works, and educating our kids, even during this really unusual time, coordinating with the region and other cohorts, health experts who've been advising the city. And again, this is information we're engaged with every day. People have ownership of certain sectors of the response, and it has put us in a position to be nimble, to be quick, and to be decisive. But there are 4 main areas of the city's response: public health, resident support, the local economy, and city school services. Public, at the end of the day, everything is about supporting our residents. Everything we do, whether it's on food access, distributing masks, working to support the Somerville Cares Fund, our seniors, our immigrants, advocating with our state delegation and others to pass residential eviction moratoriums or take city action on that, or housing assistance. It's all about supporting our residents during this critical time when our health is threatened, and as well as our livelihoods and our ability to provide for our families. But I do want to talk a little bit about our public health strategy. So preventive measures such as mask distribution, face covering orders, social distancing, bringing in the Battelle critical care decontamination system down at assembly to clean N95 masks, and public sanitation. They're just some of the things we are part of public health strategy. The narrower or the more macro level interventions we try to advocate, implement, or utilize. Now we're excited that widespread testing is now available and free for all residents. Along with the Cambridge Health Alliance and now with other communities, this has been a regional effort. But in Somerville, if you want to get tested, you don't have to have insurance. You don't have to be connected to the Cambridge Health Alliance. You need to just make an appointment. You can call 617-665-2928 to make that appointment for testing. You can go to the drive-up site or walk up and bike up site at Somerville Hospital on Crown Street. And we'll soon be seeing a mobile unit throughout the city in strategic locations. We have a strong emphasis and focus on engaging our vulnerable population and making sure they get tested and have access to those services. And we're also coordinating our testing and intervention around this area with a safe isolation for everyone who has COVID-19. So those who cannot safely isolate at home can stay at a Mass General Hospital, MGH operated hotel facility in Revere. This is a partnership between the city of Somerville, Revere, Chelsea, Lynn, East Boston. We provide transportation, meals, medical services provided. We utilize school and city nurses to support communities, support families of those individuals test positive to, one, provide them shelter, guide them to shelter services or other essential services such as food and so forth that they'll need for their household. So as we talk about supporting our residents and the many things we do along those lines, again, I mentioned from mass distribution and senior services and supporting our immigrant community and the other vulnerable populations. I want to pass this off now to Jill Latham. Jill?
Hi there. Yes, it's just been really exciting with some city of Somerville behind Mayor's leadership. We've done a phenomenal job with making sure our residents have what they need to get through this pandemic safely. The food and mass distribution project has been phenomenal. What an incredible community we live in, that volunteers and staff have really come to the forefront to make sure that we have what we need. More than the grab and go meals for all, more than 30,000 meals distributed at the schools in the first 9 weeks. They're averaging about 4,400 meals per week, which is absolutely phenomenal in our community. Our COVID food pantry, roughly about 21,000 pounds of groceries distributed each week to more than 2,600 people that are delivered food. Somerville cares about our community, and that's what makes us stronger, and that's what's going to get us through this. Well, also with the phenomenal leadership of the mayor, just really laying down the pace that he wants to make sure that everyone in Somerville has access to a mask and safety, and that he wants everyone to survive this. So our mass distribution Again, with the over 5,700 masks distributed this week, our police departments have done a phenomenal job heading out, giving out masks. We have masks that are going in our food bags and our groceries, both at the food pantry and the Somerville Public Schools in their 5-day-a-week program in the mornings. We have also masks that have gone to our seniors and our housing communities. And so we are committed to make sure that the citizens of Somerville have what they need to be successful through this pandemic. And we will get through this, and we'll continue to fight the good fight.
Thanks, Jill. I'm sure we'll have questions at the end. Now to take us through our testing, our approach to testing and enhancement of testing resources here in the city. We recognize the Director of Health and Human Services, Doug Kress. Doug?
Thank you, Mayor. I appreciate the time and energy everybody's putting into this. I do want to say thank you to all of my neighbors and community members here in Somerville. We have done an amazing job. I'm going to reiterate a couple things the mayor already talked about, is that, the city of Somerville, in partnership with CHA, is now offering free testing to anyone in our community, regardless of your ability to pay, your insurance, your status level. This is available for all residents. So we understand the spread of this virus and be able to move forward with it and use this as part of our information, part of our data, to be able to reopen our community and do it in a thoughtful way Just as a reminder, to make an appointment to get tested, you would just call 617-665-2928. And we have a team of people who are willing and able to take those calls from a variety of languages and schedule that appointment for you. You do need an appointment in order to get this test done. And the test currently is happening up behind the CHA Somerville Hospital, just up on Tower Street. And people will be able to walk up, bike up, or drive through. So they make it very easy for you to do that. But again, you need to have your appointment. We are lucky enough to actually expand this testing opportunity, in which we are partnering with Curtatone Ambulance, and we're putting together a mobile unit where we're able to reach out to our most vulnerable community members, including our seniors, and we will be bringing the testing to them rather than have them worry about coming up and doing a test up at that site. So they can stay safe in their high-rise buildings or in their apartment areas to make it safer for them. Again, they will still need an appointment, but we're working with SHA as well as a variety of our other senior buildings to make sure that we make it as simple and easy for them as well. Additionally, I want to kind of re-emphasize, because I know there's a lot of questions out there asking, should I get tested and why? We have the tests available. Yes, we are encouraging people to be tested, including people who are asymptomatic, which means you don't have any symptoms at all. We know that many people may have the virus and not even show any symptoms. That's something that's been very challenging for us since the beginning of this pandemic that we have in front of us. Getting tested will give you information, and it's a baseline bit of information for you. If you test positive, we can help you get isolated and make sure that you're not spreading the virus. But if you're negative, that's great. You should continue to practice those public health efforts that you've been doing and stay negative. However, if you do begin to have symptoms, you should be able to call your private or your primary care provider and get really instructions on what to do next. And yes, you can be retested and to confirm that status. Now, the other thing to keep in mind is if you end up putting yourself at a high risk situation and you worry about possibly getting infected with the virus, should you get retested again? Absolutely. Again, we want to be able to offer this test to anybody, reducing any barriers for anybody to get this test so that we know who is testing positive and we can help flatten that curve, but also be able to open up our community in a better way. So I do encourage everybody to consider that and moving forward. And again, just call that number for your appointment at 617-665-2928. Thank you, Mayor.
Thanks, Doug. I know we have some people on the call who live in the city or in general maybe owners of local businesses, and we're, again, acutely aware of how this crisis is also upended our economy, turned it upside down. It brought it almost to its knees, and individual families as well who have had a hard time to make ends meet. And many of those people are also small business owners. To talk a little bit about what we're doing to support our local economy, I want to recognize Tom Galligani. He's the director of the Economic Development Division for the city of Somerville. Tom?
Thank you, Mayor. Again, we recognize that this has become probably the biggest economic crisis our local economy has faced. And just want to let you know, we're here to support our businesses and our entrepreneurs that really make up the fabric of our community. And we're doing that in a number of different ways. Number one, we're providing useful information to our businesses, connecting them with the latest information from the state, the federal government, funding opportunities, and other grant opportunities that are available for our businesses. We're also providing intensive coaching and support. We provide technical assistance through our one-on-one coaching program. So if you're a business owner in Somerville and need some advice, need some specialized advice, we have a whole roster of consultants who are available to meet with you and support you and give you advice. If you're a resident of the city and you own a business somewhere else, that's fine. We want to help you too. So please reach out to us and we'll be happy to match you up with a coach. As I mentioned, we're helping folks with grant application assistance. For instance, the Triple P program and the EDIL program that the SBA operates. We're happy to sit down with and help you or provide other coaches that can help you with that advice too. We've been hosting weekly town hall meetings with our businesses in 3 different languages: English on Thursday afternoons at 3 o'clock, and Portuguese at 5 o'clock on Wednesdays, and in Spanish at 4 o'clock on Wednesdays. So please reach out to us through those needs as well. And you can find information about all these different resources at somervillema.gov/COVIDBizHelp. Also want to mention that the mayor announced a few weeks ago a $1 million small business COVID-19 relief fund. We're making available up to $10,000 in forgivable loans to our small businesses. And we've had over 300 applications submitted, and we're in the process of evaluating those and are in a position to announce some awards within the next couple weeks. And then we're also working with the rest of the team and with our community partners to aid and support reopening strategies. We understand it's sometimes confusing for some businesses, but we want to work with you to support those efforts and to support opportunities to make it easier for you, especially restaurants, in the next couple of weeks as we look to activating our public spaces to support our businesses as well. And that's what I have. Thanks for the opportunity.
Tom. Thank you, Tom. I'm sure we'll have some questions. The mobility team, and you'll hear from Brad Rawson shortly, has been working on Shared Streets Plan, which is just announced, to provide more walking and biking routes that allow for social distancing. I know that has come to the pleasure or excitement of many in the community who've been engaged with us in making requests. So we're going to be piloting the first shared street route by the end of May, and more will follow citywide throughout the summer. The mobility team is also preparing plans for expanded sidewalk and repurposed space in our business districts as part of our effort to reclaim the public ground and adapt the city more towards a human scale. So I'm going to ask Brad Rawson to go a little bit more detail.
Thank you, Mayor. Again, my name is Brad Ross, and I serve our city as Director of Mobility. When the emergency first came to the fore, the mayor asked our team to prepare a series of holistic mobility strategies to keep our community safe and to keep our community moving during and beyond the emergency. We all have essential trip making that is required, and that even though we know that we are safer at home, we need to get to the grocery, to the pharmacy, to the post office, and to food pantries and other essential trip destinations. And that often, although motor vehicle travel volumes are up or down, travel speeds are up. And the last thing that our hospitals need right now is a crash victim occupying a bed that should be preserved for somebody suffering from COVID-19. The last thing that our first responders need is to be responding to a crash site. And so we have been working to calm traffic in Somerville's residential neighborhoods and make sure that people have safe, equitable walking routes to useful destinations like the grocery, the pharmacy, the post office, and so on and so forth. So we're excited to begin rolling out a pilot program. These are low cost and movable materials. And I want to be very clear, we are using a shared streets model. Motor vehicle access for residents, for first responders, and for delivery vehicles is maintained in this program. However, convenient regional cut-through trips in our residential streets will be discouraged. The strategies that the mayor has asked us to implement are rooted in international best practice, but they're also customized to Somerville's context. So we've been working with our incident command team to make sure that we understand how to continue flattening and smashing the curve. I want to be clear that motorists on these shared streets should expect to see people walking and rolling in the middle of the street, so maintain slow operating speeds. I want to emphasize that facial coverings are required and that a citywide network will be established. These are not Memorial Drive in the summertime, and this is not Porch Fest. This is about functional trip making at slow speeds for people walking, rolling, and riding bicycles. So I'll be happy to answer questions later, Mayor. Thank you.
Thanks, Brad. So I want to now bring it back to Ellen Schachter. You know, we also have been very concerned and very aware that people, people are concerned about what happens when the moratoriums and evictions, residential and commercial, especially residential, expire. How people are going to pay their obligations for rent. And what we cannot afford to meet our goal of ensuring public health and safety is people being displaced and not having homes or shelter. What we can't afford if they want a sustainable recovery is people to be left without a home for their family in order to contribute to their municipality and their local economy. These are issues we're focused on here locally, issues we work as part of coalitions at the state level to pass legislation like the eviction moratorium. And the other question is, how do we continue to work to get direct resources, assistance to pay rent and other bills, and provide other necessities for families, renters, and homeowners alike. So I'm going to hand this off now to Ellen Schachter to go in more detail. Ellen?
Thank you so much, Mayor. I want to thank Mayor Curtatone and the administration for their unwavering support of housing stability in the city of Somerville. I know that many of you and your neighbors are concerned about how you're going to maintain your housing stability in the city of Somerville. As renters, how you're going to pay your rent. As homeowners, how you're going to pay your mortgages. And as landlords, how you're going to pay your mortgages and maintain your properties. So I wanted to let you know that right now, currently, we are able to assist tenants, homeowners, and small landlords with accessing both rent and mortgage assistance. I also wanted to let you know that we are in the process of developing new rental assistance program through federal monies that are coming in and other sources, and we feel confident that we are going to have the resources to be able to help those people who are facing housing instability as a result of COVID-19. So I'm encouraging you to please reach out to us. We can respond to people in any language. You can see on the bottom here, there's 2 different ways to seek out our services. One is through our phone line, and that's 617-625-6600, extension 2581. Or there's a very simple online referral form at our website, www.somervillema.gov/OHS. And we will get back to you. I would ask for a little bit of patience. We do have a high quantity of people who are seeking assistance of our services in order to access rental and mortgage assistance. So be patient, but we will be back with you, I promise. Just very briefly, in addition to rental and mortgage assistance program, our office can work on eviction prevention. Right now, there's an eviction moratorium that will last approximately until August 18th. But after that time, or before that time, if you have any questions about the moratorium or anything else, we are here to answer your questions. We can assist with housing search. We provide homelessness prevention and rehousing services. And when the moratorium and when the health situations allows, we will do live workshops and trainings for tenants, landlords, and homeowners on housing related issues. And last, we work closely with the administration, with the city council, with our state delegation to enact policies and programs that promote housing stability in our city. So thank you. We look forward to hearing from you. And thanks so much to all the volunteers out there who have helped us to promote these programs around rental and mortgage assistance.
Thank you, Ellen, very often we feel a lot of questions these days around accessing a variety of services for individuals, for their families. So at this time, I'm going to ask Luciana Quintanilla to update what services are available and how you can seek information on those services. Luciana?
Of course, thank you very much, Mr. Mayor. And thank you, Ellen, for bringing up all this information about housing, which is a very important resource we have right now. So a wonderful resource we have available for everyone is the help guide at the city's website. So you can access it through somervillema.gov/coronavirus-help. And it is indeed very comprehensive. You can find information about how to access resources in food, housing, financial assistance, mental health, survivors of domestic violence, recovery services, and so forth. A lot of services you can self-refer. You can find the information right in our website. And if you have any questions or need more information about how to access any of these resources, you are welcome to contact me either at my phone number or my email address. And I will be happy to help you navigate through all this information and any referral processes that you need.
Thank you, Luciana. So that's the presentation, folks, from our panelists. Before we get on to question and answer, a reminder, you can submit your questions through the Q&A function on Zoom, or you can comment on YouTube Live. Before we do that, and I also have some questions submitted in advance, I'll go back and forth. I'm going to recognize, first I want to thank the Somerville City Council led by President Matt McLaughlin and every councilor for all their work. They've stepped up, they've participated and assisted different sectors of the emergency response team and the incident command staff, the Somerville School Committee. Together they've worked hard, they've volunteered, distributed food, masks. It's really been a community-wide effort, as well as all the other volunteers who pitched in. But I do want to, I think Jesse Klingon from Ward 4 and our new City Council at Large, Kristen Strezzer, on the line. Jesse, you want to say hello? Jesse, you on the line?
Hello, Mayor.
Hello, Councilor. Welcome.
I am here. Thank you for the opportunity to speak to great residents of Somerville. I just want to commend you and your staff on a job well done so far. I know we have a long way to go, but I look forward to just staying in this fight. And again, I actually want to commend, I was out today delivering some food from the Somerville Food Bank. They're always looking for volunteer drivers. They're running out of the Kennedy right now, the Kennedy School. I encourage everybody to get in touch with Lisa Robinson from HHS or Department of Public Health. But yeah, so let's just get through this. Let's keep doing what we're doing. Keep staying safe. Stay masked up and stay your distance. And hopefully we'll get through this sooner than later. And shout out to all of our businesses that are hanging in there. And again, just thank you all and keep it up.
Thank you, Councilor Klingon. And Councilor Kristen Strezzo, welcome.
Thank you, Mr. Mayor. I want to thank you for your leadership on this. And I want to thank you for your communication and information, because it's so vital right now. Connection is so vitally important right now. And I want to tell our residents that I'm here right alongside you, day in, day out. And I'm looking forward to being on the other side of this, sharing smiles. So thank you very much.
Thank you. And I do want to recognize from Ward 7 City Council, Ms. Katrina Ballantyne. Welcome, Councilor Ballantyne.
Thank you. Thank you, Mr. Mayor. Thank you to the staff also. And most importantly, I'd like to thank you to our community for doing their part to make our town, our city safe by staying home, by volunteering. I know many of you have bought food for your neighbors. You've made grocery runs. You've packed groceries for delivery to families. You've actually delivered meals. You've donated to our small businesses, our arts, and our schools. and I thank you for that. If I can be of assistance, my telephone number is 857-928-6852. Thank you.
Thank you, Counselor. So folks, at this time, we're going to go on to Q&A. Because we've gone on longer the presentation, we will stay on as long as we have to answer and try and answer all these questions. So we're going to get right to it. Let's just adjust something here on my screen. So again, welcome in advance. Thank you to all those who've submitted questions. I'm going to take the first one that's been sent in. I'll go back and forth. The first one, and again, whoever sent it in, thank you. Not everyone put their name, and I won't read the full name. It's regarding schools and universities. How are you working with Tufts University to ensure that their students, especially those living off campus in our neighborhoods, to ensure that they will adhere to town protocols, example, giving social distancing, wearing face masks, etc.? Well, we will continue our engagement with Tufts University, as well as they think about whether they're going to open in the fall. We suspect they will, though they haven't finally announced it. We're hearing slow rolling news about other universities, Northeastern a few days ago, Boston College today. I do want to commend President Monaco and the Tufts University administration. They've been incredible partners in our response to the COVID-19 crisis. They've been the leader, and he has been the university academic leader in utilizing the campus assets to help us create quarantine isolation units for first responders, those needing a post-acute care, and other resources. I thank them for that. And they're in contact with the city, and we will be engaged with them on how we can educate students, provide resources, because they are going to be members of the community, so they can participate in our response to the resurgence. So thank you for that question. More to come. The other question regarding schools and university: how does the city plan to reopen schools while protecting children and teachers and staff? Very important question. When we say the new normal, we still don't know what that will look like for many aspects of our life, especially our children in our public schools, our teachers and our staff. Local leaders like myself are working with our superintendent, school committee administrations across the Commonwealth, and the Department of Early and Secondary Education. There is a working group at the state level working to formulate guidelines and protocols. At the same time, here in Somerville, we're trying to imagine what that new normal looks like. And there's many scenarios. Schools don't happen in the fall, and I would tell you that the likelihood that that could happen is still very real, because if a resurgence hits and we don't all do our part, we can find everything locked down by that point. Assuming school does start, all the kids come to school at once. Some come on some weeks, others the other, some are virtual. Those are all the scenarios being contemplated locally and from the Commonwealth. I suspect the Commonwealth will be coming out with guidelines soon. I expect they'll provide expertise for cities and towns across the Commonwealth. Myself and leaders, other mayors and managers have requested that, so that we have a full understanding and resources available to plan for that readiness, so that when our kids go to school, they're kept safe. They're kept safe, and we know students, and the reason we closed schools at the beginning, we knew those were centers of increased, a really elevated risk of transmission of the virus. So we need to make sure they stay safe, they're not vectors out into the community. So more to come on that. I'm going to go now to the questions. And again, if I don't answer a question, I'm going to hand it off to one of the panelists. I don't want them to get bored tonight. So this question came in from Peter. If I messed up this name, Peter, I'm sorry. Ozwaka. Again, I apologize, Peter. Let's just say Peter O. Now that there is more and more evidence that the risk of COVID-19 transmission outdoors is low, how are you changing your policies to reflect that new evidence? Well, Peter, we will develop our policies, adapt or reconcile them based on science and expertise and those who are informing us. We know, for example, and there's a recent study that came out, the impacts of masks and face coverings in China. If you compare how they're dealing with the resurgence and the number of new cases they have with the United States, that's very effective. We may make adjustments to the mask policy to be more uniform with other cities and towns. For now, they're going to stay in place, but we'll take this approach with every policy as we move forward. Again, the situation is going to change. And as we become more aware what the trigger points are for the Commonwealth and the governor to make adjustments on phases, whether we stay in a phase, whether we roll back, whether we go to total lockdown or advance, we'll adapt our policies. We're leading the way with science, with data, and keeping the health and welfare of everybody at the forefront. So more to come, Peter. I thank you for that question. And the next one is from an anonymous attendee. Will your framework for evaluating safety of opening various business sectors rely on data just from Somerville or state or region-wise? Our data, we will use every data source possible. Thank you for the question, first of all. We will, one, look for science, look to science. And as I mentioned earlier, as we've been advised by experts, activating sectors of the economy that attract people who are connected to broad networks of people is something we're very focused on. It is very dangerous. We delayed houses of worship because we know houses of worship, and the cases are there, most recently in California, where people come into contact with one another. And even though there's a 10-person maximum on activities, houses of worship were still left with 40% capacity. That number, one size fits all, doesn't fit every circumstance. And we need to be very aware how that plays out and the impacts it can have in terms of elevating risk of transmission. Our job is to continue to interrupt the transmission of the virus from person to person. We also want to keep workers safe, our essential workforce safe, and the vulnerable population safe. As we activate sectors of the economy, I want to remind everyone, many of those people in the vulnerable populations, they're not working white-collar jobs. They're not going to be working virtual. They're going to be working at the grocery store. They're going to be working essential services to support you and I. And we need to make sure that they're not at greater risk of being susceptible to the virus than anyone else. So we'll be advised by all the data points and portals that are available to us, but relying on science and health experts really at the forefront. Thank you very much for that question. More to come. This question is for Fernanda Macedo. Please address what please address what date salons can open, knowing some of our clients are being exposed to COVID-19 by going to neighboring salons. Thank you for the question, Fernanda. We will come out with further guidelines regarding salons, hairdressers, pet grooming, and the other sectors we are not activating at this time. We are fully examining and reconciling all the guidelines submitted by the Commonwealth. Again, one size fits all doesn't mean it fits for some of them. We're not the same as the Berkshires. While other communities may take different approaches, some are taking the same as Somerville. You know, we're not going to do something just because somebody else did it. When the Commonwealth didn't want to close schools, Somerville and others led the way on that. When the Commonwealth did not want to issue stay-at-home advisories, we took that action quickly. In a crisis, we need to be deliberate, we need to be flexible, we need to be bold. Coming out of it, we need to be extremely measured. And we have been advised by experts, many of these sectors that are being activated should be a slow rollout, especially not doing anything for the vast majority of them before June 1. So in the next several days, we'll be actually meeting with these different sectors like hair salons and other personal services to help them understand those guidelines, to help them understand they can comply, and in any other enhancements to the guidelines we may provide. So stay tuned, and I thank you very much for that question and appreciate you participating. So going back to the questions that were submitted in advance, the next one is on construction. How has the coronavirus impacted the Green Line Extension project? Whoever submitted this, thank you very much. That project, the Green Line Construction project, has always continued. It is not a city permitted project. As you know, we have brought a halt to all those projects, city permit and private construction in the city. We do not have jurisdiction on that project. However, they adapted COVID-19 guidelines. They've been adhering to them. We've heard no reports of anyone this time either becoming ill from the virus or any other data from that, negative data. And the construction project is moving ahead on schedule. You should be hearing news shortly regarding certain bridge openings, such as the Washington Street Rail Bridge and the Broadway Bridge. But thank you for the question. All full steam ahead on that. The next question is from an anonymous attendee. Also, what is the best route to share our industry-specific questions, concerns, and recommendations with city leadership? Thank you. You can send them to the City of Somerville's Economic Development Division. Tom Galligani was on the line. You can call 311 the City of Somerville. Go to our city's website and on somervillema.gov and go on to OSBC, the Office of Strategic Planning, Community Development, into the Economic Development Division. And also, Tom, we can put up your email one more time out here, and you can call Tom directly. We will be holding more sessions regarding the particular sectors that are in temporary hold over the next several days to provide you more information, including trying to project the timeline for your opening. Thank you very much. This is from Ron Newman. Ron, I have to commend you. No matter what the situation, crisis or not, you are at every meeting. You are a true Somervillian. Thank you. Ron's question is, I am concerned by the governor's allowing places of worship to reopen this week. There was a well-reported incident in Washington State. where most of the choir came down with COVID-19 after a rehearsal, causing several deaths. It appears that group singing is a serious health hazard and should not be allowed for the time being. Thank you, Ron. Houses of worship will not be open at this time. I have already scheduled, I forget the date, a meeting with the interfaith leaders across the city to discuss how we can think about reopening in a safe manner. Houses of worship, there was a great Globe article yesterday, and one of the experts in that article is Dr. Samuel Scarpino. He is one of the experts who's been advising Somerville and other municipalities, cautioning against the opening of houses of worship, because as you mentioned, we've seen elevated cases of transmission and people vectoring out to the community. There's also 2 well-documented cases in California as well. And we need to be very smart, informed by science when we think about activating different sectors. I understand. I'm so sorry that people's opportunity to pray and worship in their churches, their temples, their synagogues, their mosques is not possible now in Somerville and many communities. But we will be working with your faith leaders to understand how we can do that while fully ensuring that people remain safe. We want to make sure that happens. Thank you for the question, Ron. And again, more to come. There's another question on data. And I'm going to actually pass this down to Omar and Doug. On data, can you update the chart to show, that's been our COVID-19 chart, update the chart to show how many people have been tested in total in addition to how many have been tested positive? Omar or Doug, do you want to take that?
Sure, Mayor, I'd be glad to take that. Again, Doug Press, Director of Health and Human Services. We have some of that data. I think we also have to keep in mind that a lot of that data is very limiting. As you think about the way we have been testing in the past, the testing originally was scheduled only for people who were starting to show symptoms. Only until recently have we been able to expand that testing, thanks to the leadership of the mayor and the city here in our surrounding communities, where we're actually testing anybody so that we have a better understanding of where we're at and how this is moving forward. So we have some of that data, but I worry sometimes when we start to publish some of that it will be misleading. So we want to make sure that we give all of you the most accurate information and up-to-date information that is usable for all of you. To make that happen. I do believe in our data that we're already showing is we're showing the number of positive cases, so you'll be able to see where those positive cases are at.
Doug, the other follow-up question to this is, can you also please include how many people have been tested daily, not only to count the sick, those who've, the deaths or recovered? It's the same type of question.
Yeah, so again, I would look at that data and say, you know, we can pull some of that data, but we also don't know where other people are being tested. We can have the data information available who are tested at our community testing sites, but as you know, people can be tested in a variety of locations, and we may never know who is tested for all those, who may be tested out there. So I worry that people will think that, oh, that's all that are getting tested, where there could be many more being tested out there. So we have to always put a little caveat with any of the data that we're putting up there around the testing. As far as those who are testing positive, again, we do test our positive cases up there. And I do believe we are also publishing the people we lose, or the numbers of people that we've already lost to this pandemic.
Thanks, Doug. I have 2 medical questions, so I'm going to stick with you for now. I'm in my mid-20s. I'm an adult who has been self-isolating and do not have any COVID symptoms. I want to make sure that I'm not using up valuable testing resources. I think you've already answered this to another one, but I want to give respect to this question. Should I get tested in Somerville testing program? Is the purpose of the testing to test as many residents as possible? How many tests do you have? Quick answer would be great.
Quick answer, yes. Go be tested. We have plenty of tests. We're getting more tests in. It's important to know that. It'll give you a baseline of where you are at.
Thank you. And for this person to answer the question, thank you. We are working closely with our healthcare safety net, the Cambridge Health Alliance, and along with partner communities of Cambridge, Malden, Everett, Revere, even Chelsea, which is not a CHA community, but many of their residents access the clinic on Broadway, Revere, as part of a regional approach adopting the Somerville model. And we've been fortunate enough to get more swabs, more supplies to support the testing efforts. Cambridge Health Alliance now conducts testing at their own lab on site as of last week, and they're able to turn results around in 24 hours. The goal is to make sure we allow anybody who needs a test to get a test. So thank you for the question. This next question, Doug, is from Catherine. She states, I was diagnosed via telemedicine to have had moderate case of COVID-19. Are their tests available to check for the virus antibodies? If so, where might I access one?
That's a great question. Thank you for that, Catherine. We do appreciate that. Antibody testing, there are some antibody tests that are out there. However, keep in mind, none of those have been FDA approved as of yet. However, we are working eagerly to hope to find tests that might be available to do that antibody testing. This is a changing environment every single day. We're hoping that more and more tests will be available, especially around the antibodies, where we can actually bring that to our community as well. So please keep your eyes open. It's something we're looking forward to.
Thanks. I'm going to go back to the Q&A function, and this is from Christine from Here by Christine. How you doing? Hope she's still on the line. I am a salon owner in Somerville. She is on Highland Avenue, and I don't get my haircut there, but I know everyone loves it there. I agree with Mayor Curtatone that salons should not be opening up phase one. I also believe there are things that should be implemented that were not mandated by the governor and the advisory board. How can myself and many other salon owners that I have been working with be able to help providing a few more standards and procedures that we feel will make our stylists and our community even safer when we do in fact open? Christine, thank you. I would say stay tuned. We're going to reach out to you and all the salon owners and barbershops and stylists and have a town chat on this, and that input will gather there. That'll help inform us how we can be successful in opening one for your business, but also to give people confidence. I think people need to understand consumer confidence is at an all-time low. And if we don't have a plan, not just in Somerville, but across the Commonwealth for all these sectors that people have confidence in, they're not going to frequent it. So Christine, thank you for that offer. We're going to take you up on it. Stay tuned. We'll be having that meeting. This next question is from Evan Hackle. Evan says, thank you. I think Somerville has done a really amazing job in this crisis. I feel proud to be a resident of Somerville. You've been really proactive. What more can we do? If you felt that citizens of Somerville would step up more, what can we do? Evan, thank you. Appreciate the words of praise. We're here to serve you. You've all been great. So we need you to continue to educate people you know that we're not over this. People are celebrating that we're getting out of the surge as if it's done. This virus is going to be with us for a long time. People will continue to be sick. People will continue to die. And if we don't take the measures in place to stem that spread and to take on the resurgence with greater, more boldness than we did at the beginning, and being smarter about it, then the resurgence will overwhelm us. There are plenty of opportunities for you to help out if you want to volunteer. You can call 311. Check out the city's website at somervillema.gov/coronavirus. For those of you who have the ability, I know these are tough times, if you want to donate to the COVID-19 relief fund that supports those people really in dire circumstances, we'd love to have you do that. But Evan, thanks for your support, and check us out. There's plenty of opportunities to participate and help out and volunteer. We'd love to have you help. Okay. The next question online is from an anonymous attendee. What's our testing capacity and how's it scaling in parallel with these reopening changes? Doug, I think you can give a brief answer to that. You kind of already done that.
Yeah, we are doing over 100 tests every day. We're actually over 200 tests every day currently up at the CHA site. As we expand in doing the mobile unit, we'll be expanding that to double it, if not more, so that we can continue to reach as many residents as possible. And I want to remind people that if they can't get an appointment in at the CHA at ours, there is a chance there may be an appointment available in one of the other clinics. As you mentioned, CHA is doing this in all of their clinics throughout our area. So there may be an opportunity for some who want to go over to Malden and maybe try that as well.
Thanks. We have two salon questions. I'm going to answer them both at the same time. We've kind of already done that, but Kevin G writes, we understand that hair salons are not essential services, that they aren't appropriate for phase one activation, but we ask that we receive guidance on the operating standards required to open with as much notice as possible so that we can be well prepared. But can we expect specific information to be released? And the other anonymous attendee says, when do you think we'll be able to open hair salons? What phase? To that person, again, we are evaluating, we'll have an answer over the next several days. We're evaluating all the guidance now. We plan, as I mentioned to Here by Christine, that we'll have a meeting with all those stakeholders in that sector to get your input and guidance, as well as to Kevin's question. And I agree, Kevin, you need to have, one of the things we push back on as local officials is you've got to give people runway that they may be open on this phase. One of the comments I'm getting from those of you who call me personally is like, even if I wanted to open up today, I can only meet 70% of the guidelines. Part of what we want to do is not only understand how you can meet the guidelines or whether we want to enhance them, but what we can do to help you achieve compliance with that. So more to come on that. Thank you both for that question. The other question online in the Q&A function is, when will personal home construction be able to take place again? I am hiring a contractor and I'm interested when he can obtain a permit from Somerville for the construction. Thank you. You can check our website. We made an announcement of construction phases. Private construction will start June 1 and phase 2. You should call the Inspectional Services Division. They're a bit overwhelmed, so give them a little chance. Send an email. Every project, public or private, must do a job hazard analysis and submit a site safety plan before commencing construction, as well as obtaining their regular permits. So please call ISD, check the website, call 311. We'll guide you in terms of what you need to do. Can you speak, is the next question for Wendy. I'll leave this to you, Doug. Can you speak to how public school nurses are doing contact tracing and are imperative to the spread of the COVID-19? I doubt the public is aware. Thank you, Wendy. Unheralded work, spectacular work by our school and public nurses. Doug, you want to chime in on that?
Absolutely. I can't say that enough. We have an amazing team of 20 different nurses who are working on this, on this effort. And what they are doing is they're contacting those who test positive and making sure that they have access to any of the services that a variety of our panelists are able to respond to. They're doing the contact tracing so that we can find out who they may have been in contact to slow the spread of this virus. They are valuable. They are heroes. And we can't forget about all of those nurses that are out there doing this work. We have public health nurses, as well as our school nurses who've moved over to help us in this endeavor to make sure that we have the opportunities to reach those residents. And they are bringing our language capacities to ensure that our residents who do not speak English or have limited English are able to communicate and get the correct information they need. They have been an amazing team of individuals.
Thanks, Doug. The next question submitted in advance of the meeting, 2 on social distancing. 1, are there plans, and we've heard this already, but I'll just restate the answer to it. Are there plans to close certain streets or squares, an example, Davis, to vehicle traffic for increased pedestrian bike use or outdoor restaurant seating to allow more outdoor freedom over the summer while indoor activities are still restricted? Yes, the shared streets model for phase 1 has been announced, and we'll be rolling out more streets and sections of the city throughout the summer. Brad answered this, and Tom Galligani alluded to, in terms of restaurants, when they actually do open beyond takeout or delivery, one of the things we are examining is sort of sharing the public realm. There's a separate subcommittee of the Reopening Advisory Board that is meeting on this for the Commonwealth. This will be another sector of stakeholders in our economy that we'll be engaging in a meeting as those guidelines roll out, to engage with all of you and understand how we can effectively open this important part of our economy, but do it in a safe way. So more to come on that, and thank you very much. The other on social distancing is, please address how you will be enforcing social distancing, which is the proven way to stop the disease. Now that people are wearing masks, walkers aren't moving on the sidewalks although for maximum distance. The question is addressing the problem where walkers, runners are actually following the rules. It's a good question. Omar, do you want to give a shot at that? And then I can answer it.
Thank you, Mayor. If I understood the question correctly, it's about education and social distancing. Our approach from day 1 has been to focus on providing our residents with accurate information, trying to educate them around the dangers that they may be facing when they're in close proximity to other residents who may not be part of their family unit. And we have deployed various resources in order to ensure the correct and proper and consistent flow of information, from signage to our city communications to both via emails and on our website. And we have deployed a specific unit in our police department specifically focused on compliance, especially on congregating and facial covering. And that also includes, on top of educating folks and providing them with what we know are facts, they are armed with masks. So they're focusing on providing our residents with the tools and the information in order to abide by the rules that we know help us mitigate the spread of the virus.
You know, at the end of the day, also, I know Evan Hackle asked this question too about enforcing the mask fine, is that we want compliance, we want to educate people. The last thing we want to do is hit someone with a fine. If someone's physically able and just refusing to do so after we're speaking to them, we will fine them. But we've had really good compliance. Although there's still some who are ignoring it, people who are showing a good faith effort, we're not going to fine. Overall, we've seen better compliance around the city, and we'll stay on top of this. There's another question on masks. This is from Ian. How long will the donated homemade mask drive go on? Question.
I could answer it with Jill if you'd like. We have a current stockpile of about 100,000 masks currently that we're distributing based on a set of tiered priorities, focusing on our most vulnerable residents, seniors, and low-income residents. And our goal is to be able to provide any resident who is in need of a mask with a mask. So you can call 311. You can approach one of our neighborhood police officers who are always armed with those masks. The point is, as long as we have our stockpile, we'll make sure that our residents have access to them.
Thanks so much. To a couple of questions submitted in advance. One on accessibility. Will there be an online option for our students that have someone in the family with high-risk conditions? So let me repeat that again. And rephrase it. Will students who have those in their family with high-risk conditions have an online option available to them? This infers that the concern that if they could transmit the virus to that vulnerable person in their family. Thank you for the question. Those are scenarios we're currently evaluating. We'll evaluate with the Commonwealth, and more guidance will come on how to deal with those situations. We're very aware that people have folks at home who have underlying medical conditions that make them more vulnerable or diminished or weakened immune system. So stay tuned and more to come on that. Thank you for that question. The next one is on masks again. Will you bring your mask guidance in line with the states requiring masks outside only when in public places where social distancing is not possible, rather than under all circumstances? If so, when? Those are things we'll continue to monitor. At some point, I'm sure we will. We're not there yet. We'll continue to look at the data. We'll continue to look at the trends, and we'll continue to look where we can reconcile our local policies, interventions with the Commonwealth where it makes sense. I would say stay tuned. There may be some adjustments coming in the future. Thank you for that question as well. Now going back to the Q&A function. This is from an anonymous attendee. Thank you for this question. Will there be any serology testing offered by the city to get an idea of how many people may have been exposed to COVID-19? Doug, you've alluded to this. Do you want to answer that? And Omar as well, if you'd like.
Yeah, thanks, Mayor. Yes, we are hoping to bring something in. It's
Doug, you're muted.
Shouldn't be. Is that better? We are working on that and hoping to bring some of the antibody tests as soon as they're able. Again, as I said earlier, it's an evolving situation that we have, and we hope to have something that's reliable soon so that we can start that type of a testing as well.
Just to add to that, the city is working with the Broad Institute to facilitate a study similar to the one that took place in Chelsea a few weeks ago. And just to add to what Doug just mentioned in terms of trying to get access to a serology test, some of the difficulties were because of the sensitivity of certain tests or lack thereof. So we're trying to work with health professionals to make sure that the test that we get and the analyses that we obtain are useful, are not faulty, and provide us with the proper data in order to be able to measure either the impact or the spread.
We're going to take a couple more questions on testing here. One, I think we already answered this one. Will there be a limit on how many times a person can be tested for COVID-19? The answer is no. There is no limit. Can you please comment on the outcomes to date of the contact tracing program in Somerville and Massachusetts in general? Doug and Omar, quick answer on that.
Sure. The contact tracing is continuing, and I think we already talked a little bit about this, where our nurses, both our public health nurses as well as our school nurses, are continuing to do the contact tracing to follow up with anybody who may have tested positive and in finding out who their contacts are so that we can slow the spread of this virus. It's a lot of work. It's very tedious because trying to get a hold of people and continue to do that. As you've seen in a lot of the advertising that's maybe out there on television, if the phone rings, please pick it up so that we can let people know their risk and continue to be able to follow that. We are seeing also there are many more household contacts that are now showing up positive as well. And we want to keep that in mind as well. So whenever you are talking about looking at becoming, or if you are positive and we want you to quarantine and isolate, please do so because it's very easily passed on. This is an extremely contagious virus that we have in front of us. So it will spread fairly easily. So that's why when we ask you, who do you live with? It's also, who do you share your kitchen with? Who do you share your bathrooms with? Because that's an important piece. We know how easily it can spread. And that's one of our contact tracing tools that we have so that we know how far this virus has spread.
Thanks, Doug. I do want to ask Jill Lathan. Yeah. By the way, the contact tracing information is confidential and protected. I want to recognize Jill Latham just to follow up an answer regarding the mask donation program. Jill?
Yes, good evening. Yes, we have a phenomenal, mask campaign for cloth mask, and we're really trying to make sure all of our seniors in the city of Somerville have a cloth mask. And so we have donations that can be dropped off at our library book drop locations, and we are continuing to accepting more of those donations of those homemade cloth masks. It'd be great if people continue to drop those off in those library book slots. So, and this campaign will go on as long as needed to try and protect our seniors. So thank you in advance for your service.
Thanks. Here's a question on tenant rights, and I'll ask Ellen to answer this. What are our tenant rights? Can we talk to landlords about negotiating a lower rent, or should we turn to Somerville's resources? Ellen?
Thank you very much, Mayor. Right now, the way the law is that there is no specific limit on rent increases. That is something that can be determined and controlled at a state level and is not something, unfortunately or fortunately, as you may look at it, that we have the power to do locally. I would absolutely encourage you to negotiate with your landlords if you are unable to pay your rent as a result of COVID-19. I have seen many landlords both be generous in terms of not only not increasing rent, but actually decreasing rent for tenants who needed rent decreases. So absolutely talk to your landlords, try to negotiate, but you can also reach out to us at the city, at the Community Action Agency of Somerville, and at the Somerville Homeless Coalition for help with rental assistance if those negotiations do not prove to be beneficial. And last, in terms of tenants' rights more generally, just to let people know, the eviction moratorium means that nobody should be receiving a notice to quit for non-payment of any rent that hasn't been paid during the emergency declaration. So you should know that. If a landlord is not in compliance, please feel free to call us, call our office at OHS, so that we can help to reach out to your landlord to make sure that they understand what their obligations are under the moratorium.
Thanks, Ellen. I'm going to jump to a question in advance. And folks, if we don't get to all the questions tonight, we're going to stay on longer because we have a lot of questions. We'll post these answers to these questions online for you all. I apologize. We have a lot of questions. We love the engagement here. So just going to another one that was submitted before the meeting. This is from this is regarding entertainment facilities. Since entertainment venues such as movie will open with capacity restrictions, could Somerville relax its rules on midnight and late showings? This would allow businesses to get more income and diffuse crowds. Let me be clear, entertainment facilities are currently closed. When they open, we will consider all options, but we're going to be very stringent about the opening. Entertainment venues are very dangerous in terms of rate and probability of transmission. So we'll await final guidelines on entertainment venues. And we will, again, we'll give it the same analysis and approach as we got with other sectors of the economy to determine if safety and health can be ensured and it contributes to, again, sustainable recovery. So more to come on that. We appreciate the question. The other question is on social distancing. What can we do to open back up the public spaces with playgrounds that are currently closed now to allow space around the playground structures for kids to bike and scoot? Since all of the playground equipment is covered with orange tape right now and the equipment is inaccessible, why can't we open the rest of the open space? If I can sit at a bench at Perry Park or Quincy Street open where my kids can bike, why can't I sit on a bench at Walnut Street Park and do the same? It seems like considering open these spaces could alleviate some crowding. If you are doing this to streets, you could also consider opening parks in this way. There's no name to this. Very thoughtful question. Thank you. I will pass this on to Jill Latham first and to add to it. Jill?
Yes, like I said, we're kind of want to do a thoughtful phased reopening with our parks and playgrounds to make sure that we can ensure social distancing and safety. We'll continue to assess this issue moving forward and talking with and meeting with experts and making sure that we can properly clean and disinfect those surfaces and how we want to do that in a planned way.
And to add to that, the Commonwealth will be coming up with more guidelines regarding around other activities in recreation fields and sports fields and so forth. And we're going to try to time a lot of our approach with those guidelines. Again, we'll fully vet out those guidelines. We want to make sure that we're not enhancing the density of activity in any one area. That would not be good. They'll be counterproductive. It would elevate the risk of transmission. These are very good points. We're certainly bringing them to our consideration as we're thinking about how or when we would activate those types of areas. Back to the Q&A questions. Brad, I'll let you answer this. When will a map of the Shared Streets program be released to the public? Very excited about this initiative. This is from Nicole Egret.
Thanks, Mayor. Yes, short answer is that a map will be published for community awareness. I do want to help set folks' expectations that in every city around the planet that has pursued strategies of this type, there has been kind of an incremental rollout. So as we move cones and sawhorses and signage to ultimately build out a connected network of shared streets that serve all of Somerville's neighborhoods, it will take a little bit of time. So I just want to leaven people's expectations that we will initiate our first route next week as per the mayor's directions. And then we will quickly pivot to serve every Somerville neighborhood, but it will take a number of weeks to get there.
Thanks, Brad. Here's a question around contact traces. Doug, how many contact traces are you looking to hire? What is the current status?
Thanks, Mayor. Currently, we're not hiring any of our contact tracers. All of our amazing team within the nurses, the school nurses and public health nurses are doing all of that work. Those who we need, when we would need additional assistance, we have our Partners in Health, which is a contract with the state, who can also follow up and assist us at that time. If people are looking for jobs to do the contact tracing, they certainly can contact the Partners in Health organization and check in to see if they need additional assistance.
It's a very straightforward question. Is residential exterior house painting considered construction? And yes, unless you're doing it yourself, I would encourage you, if you have any questions about, and you can't find the information on the website, call 311 or the Inspectional Services Division, send an email and we'll give you a direct answer. Always describe what it is you're intending to do and who is doing the work, and they will guide you in that process. This was an anonymous question. Thank you for the question. Ellen, I know you want to answer this question. My neighbor lost her job, but her landlord just raised her rent. Is this allowed during the pandemic?
So as I stated previously, there is no specific limit on rent increases under current state law. I will note that you should stay tuned because there are new pieces of legislation that are being filed and being considered by the state legislature to follow up on the eviction moratorium law. So right now, there are no such limits, but stay tuned for the future.
Thanks, Ellen. Here's a question from Rachel Lopkin. Rachel asks, in what ways does the city collaborate or align with other towns like Cambridge on COVID-related policies? In many ways, I chair the Metropolitan Mayor's Coalition, Rachel. That's 15 cities in the inner core of the Boston region, along with Cambridge and others, as well as I facilitate meetings with a larger metropolitan coalition of more than 20 cities and towns, along with Mayor Driscoll of Salem, and a larger statewide coalition that has come about as a result of this crisis. We are exchanging experiences and ideas. We are aligning advocacy around issues such as eviction moratoriums and so forth, and also seeking legislative tools and other relief from the Commonwealth to deal with a looming fiscal crisis in municipalities, and also in terms of our COVID response. And we have several meetings a day with these coalitions or colleagues in our neighboring cities and towns. You know, Massachusetts is not big geographically, and the metropolitan Boston area isn't either. And there are 351 cities and towns, but as a metro area, we need to be aligned regionally now more than ever. And we try to work as uniformly as possible in implementing strategies or interventions. It's not always the same in every city and town, but it's been really inspiring to see the work of municipal officials, especially when this crisis hit us, when the governor and the Commonwealth were dragging their feet on closing schools or issuing stay-at-home advisories or mask orders. Cities and towns worked together like Somerville. Those came as a direct result with experts, but also other municipalities and the experts that have been advising those coalitions. So it happens regularly, and we're very grateful for it. Rachel, thank you for the question. Ron Newman, you followed up on your question looking at what I submitted about group singing and houses of worship. I see now that it was not in the form of a question. So my question is, will Somerville consider a restriction on group singing when allowing houses of worship to be open? The question is yes. We still continue to analyze what our approach will be, but that is something we will consider. Thank you for the question. It's from an anonymous attendee. Are there any plans to improve road conditions on certain streets? Some frequently used roads have many potholes and problems that are causing damage to bicycles. This seems more important than ever given the increased use of bicycles to get around. This question came in anonymously. Thank you for the question. Brad, I'll hand this off to you.
Sure. Thank you, Mayor. It is important to note that our great frontline workers in the city's DPW have worked on filling potholes throughout the emergency. We want to give them credit for keeping each other safe and keeping us safe. Beyond that, as construction restarts in an incremental phased fashion, some of the city's longstanding pavement projects and sidewalk rehabilitation projects will continue. For example, Medford Street between Magoon Square and Gilman Square at School Street is starting reconstruction this week. So yes, paving will continue, and we'll continue working to advance not only spot and emergency repairs, but the city's long-standing capital plan, which you can find online at the city's engineering department webpage.
Thanks, Brad. So I'm going to answer a question from submitted previously before the meeting in advance. Small business question: what influenced the decision to follow a more cautious reopening timeline in the state? If other cities in the Boston area allow their barbershops to reopen this Monday, are you not simply harming Somerville businesses and causing those same customers to go elsewhere? What does this solve? Well, frankly, when we believe and thank you for the question and respect your input, but you hit the nail on the head. We do this out of an abundance of caution. We do this to protect every member of our community, every worker, and our vulnerable population. Many of these sectors, including barbershops and hairdressers, we had been advised to roll out slower, closer to a June 1 opening. And we will update this sector and you and anyone who owns or works in this sector in the next several days. We've heard from many people in your sector, owners and operators, who say, one, they're not even prepared to open, or they don't want to open because their workers don't feel safe. And if we are not tightly synchronized on how we are going to be in full compliance in the guidelines, what other guidelines we should be implemented or imposed, then you will lose consumer confidence. Customers will not come back. And more importantly, people will get sick. More people get sick, more people die. And if that happens, let me tell you something. Our local economy, the greater economy, is going to feel on its own. This is a false choice to choose between health and being a successful local or state or national economy. I know that's not what you're insinuating here, that choice, but I want to make sure so you fully understand how we formulate our decision. It's deliberate, it's informed by science, from health experts, and it's with two principles guiding us: ensuring health and safety of all, and making sure that when we open and attempt to recover our economy, those efforts are sustainable. So stay tuned. There's going to be more to come on this, and thank you for your very important question. Going back to the questions online, and we're at 8:34. I'm going to go to 9 p.m., folks, if that's okay, if you want to stick around. If you don't answer your question, we don't answer your questions, only because we have a lot of great questions. We gave a long presentation. We'll try to post them online. So, what is the city going to do to better enforce bicyclists and other skateboarders, runners, etc., following the rules of the road and wearing masks, which is becoming more of a problem with less cars on the road and putting walking pedestrians in harm's way, who do continue to follow the rules of the road and new rules for safety. So I'll give a crack at this. We do see greater compliance, although I will admit, because I go out walking or jogging with my mask on and see usually the same people not wearing a mask. But we do see more people giving a good faith effort. They might be running with their gaiter or mask pulled down, and when they see someone up ahead, they pull up. We still consider that good faith, technically not in compliance, and we're not going to seek to find those. Again, for those who are physically able but unwilling just not to comply, and as officers are trying to educate and assist them, if they're not going to comply, we will find them. This also is an important thing that you can all help on. You ask me how you can volunteer. The more we tell people how important it is to protect each other. You might feel that you're safe, but you may be making someone else sick, and nobody wants to be the one who gets that grocery store clerk or worker sick, or that postal worker sick, or some other essential worker, some other vulnerable member of our population ill. We don't want to do that. Wearing a mask protects them more so than it protects you. So remember that. And that's an important message we tell everyone. And that's the message we're trying to educate people with. So we've had greater compliance, and we ask people to be patient, and thank you for their flexibility and understanding, and to really dig down deep and double down on our efforts now, because it's really important as we think about being prepared for the resurgence. Here's from another anonymous submittal regarding remote school. If remote school continues, will we be aggressive in figuring out how to actually push education forward? Currently, neighboring districts are moving forward, however, effectively or not, while Somerville is firm in its position to teach no new content. It is concerning that our kids are being left behind and may continue to be moved forward. I'd love to hear more about this question. I'm a Somerville school parent. I've been very happy how the school district has responded, but that's my opinion. That's through my lens. And this is a time where we are really concerned that kids are slipping through the cracks. We know already from this crisis, folks, that the system isn't fair and equitable to all, whether it's our economy, our healthcare system, or even providing kids an opportunity to succeed and achieve academically and socially. So this type of input is critical. So yes, we will be aggressive. We will look for bold, abnormal ideas to make sure every child has the access and resources to succeed in school and in life. So in addition to what guidance we'll get from the state of how we operationalize in this new norm, we're going to continue to make sure we double down on what we're investing in, even in these times of austerity, and not turn back the clock to provide for our kids. Thank you for that question, and there'll be a lot more to come, I'm sure. This is from Linda, and this is to me. Could you talk more about canceling events through the end of the year? What guidance are you using to make this determination? Linda, thank you for the question. The same guidance that's been our compass all along. Science, input from experts, health experts in particular, epidemiologists. We know that large gatherings are dangerous. Two of the unheralded steps, some of the unheralded decisions made at the beginning of this crisis should be talked about more. I'll point to one of them as the decision by Mayor Walsh to cancel both the St. Patrick's Day Parade and the Boston Marathon at the time. Had those two events happened, ladies and gentlemen, you'd be looking exponentially higher numbers of people ill and deaths in Massachusetts. We've seen this play out around the world. We see countries and states and regions around the world struggling with the resurgence. And we know large gatherings of people, where you bring people in from other cities and towns, regions, states, and countries, like those great events in Somerville, pose a very dangerous risk, one that we will not take with our health and the safety of our people. So we know ARPI, 20,000+ people, Fluff Fest, same amount of people, the fireworks we had to cancel, Honk. These are internationally recognized events, and it truly breaks my heart because I know how critical, we all know how critical these events are to the social fabric of our city. But we have to do what's right. We have to be guided not only by the science, but we have to do everything we can to ensure that everyone remains safe and healthy, that we do not allow for the transmission of this virus to be elevated, which will result in a resurgence that is greater than the crisis or surgence we're facing now, and that would be catastrophic. That is what guided our decision. Will continue to play a role in our decisions as we think about moving forward and the future of these events. That being said, hey, our arts community, and they're abnormal, they're creative, they're funky, they're thinking of new ideas and ways to soothe us, soothe our mental health and our emotions, to provide that cultural enrichment that we all need. And we'll be thinking of ways to adapt these events into other formats. that are safe. But for the time being, yes, for the rest of this year, no large gatherings or celebrations will be allowed, including road races or block parties. I'm very sorry, but it is very, very necessary. Here's another anonymous question. I'm already 1 month behind on my business rent. I've been patiently waiting for fund assistance results from city. How timely will you be providing financial assistance to businesses? Tom Gallegani, would you mind answering this question? And thank you for this question, whoever sent it.
Thank you, Mayor, and thanks for that question too. As I spoke about earlier, we've collected applications from needy businesses. We've closed that application window, and our team of city employees and also community partners are evaluating those applications right now. It's going to take us probably another week and a half to 2 weeks to get through the list of all 339 applications that we received, to narrow that down to approximately 100 to 120 businesses that will be eligible for assistance. So it's going to take us a little bit more time. We're working as quickly as we can to work through those applications.
Thanks, Tom. The next question comes from Britt. Britt asks, when will street sweeping fully resume? Can signs be posted to inform citizens that litter such as gloves and masks go into our storm drains and waterways? Yes, Britt, we will make an effort, more than an effort, to educate the public the dangers of that and the harm it causes. By the way, street sweeping actually resumed yesterday. We're slow rolling that out, so we need to get acclimated back into the culture of moving our cars. We'll be really pushing out a lot of reminders to folks to remind you to move your cars. We don't want to be ticketing folks now, especially when people are going without paychecks. So we don't need that type of stress on us. But we're going to communicate with everyone. I remind everyone, we've held off street sweeping, which usually starts April 1st. And now we're starting to see some sediment and debris build up on our streets. We want to get that cleaned up and keep our city clean, as well as meet some of our sustainability goals. Thank you, Britt. There'll be a lot of information and communication on this. Amber Hotstow asked, what policies has the city of Somerville implemented to support those who are food insecure outside of programs for school children? Which groups have been targeted for support? How did you make the decision on how to select them? I'm going to hand this off to Doug Kress. Thank you, Amber, for your question.
Thanks, Amber and Mayor. So let me make sure I got the question correctly, and I'm going to try and answer it as best I can, because there was a lot there. We are doing a variety of programs. We actually have done a food access program where we are providing supports for families who are quarantined, isolated, or have really been impacted by the COVID-19, potentially losing their jobs. It's something that's been started up with Shape Up Somerville, our team over there with Lisa. Have really been stepping up to the plate to work on that. We are partnering with Food for Free as well as the Boston Food Bank in order to get those to receive those foods and get those foods redistributed out into the community. Some of the challenges that we're facing with that is, of course, similar to any of your challenges that you face when you go to the grocery store, there's limited products that are available. So our supply chain sometimes can be a little bit challenging. However, we are providing over 2,100 tons of food each day to a variety of people in our community, making sure that they have the basic needs that are met. The policies that we're really looking at within those are really making sure that we have a variety of opportunities that are out there, knowing that there are challenges within the food insecurity system itself. How are we working with our existing food banks and pantries to make sure that they can also help support our communities so that they are able to still survive and thrive within our community itself.
Thanks, Doug. Another question while you're at the forefront here, Doug. Are routine pediatric vaccines included in high priority preventive care?
I'm sorry, could you repeat that question? You broke up a little bit there, Mayor.
From an anonymous source, thank you, who sent the question in. Are routine pediatric vaccines included in high priority preventative care?
Absolutely.
We're going to go back to some questions that would, and we get about 16 more minutes. And just to remind you, any questions we don't get to tonight will be answered online at somervillema.gov/virtual Town Hall. Thank you. And a lot of questions. I love it. And we will answer them all. Here's a small business question. Please allow the Somerville barbers to open along with the rest of the state. It's unfair to them if barbers around surrounding towns cannot open, but not them. I appreciate the question. I think I've already answered this. And again, we are analyzing the guidelines with the state. We do this under abundance of caution and care. We want to also make sure that you understand the guidelines fully. We've heard from many proprietors and owners of barbershop salons that they don't even know if they can meet all the guidelines successfully. And there will be no gray area in terms of enforcement. So we need to be on the same page. One, that you succeed, but two, that we ensure health and safety and that we are not elevating the risk of transmission. So more to come on that. Another question directed to me, small business reopening. When will the mayor update businesses on the Somerville plan for reopening? He had a message on 5/18 that some openings will differ from the state guidelines. Business owners need to know so they can prepare to open. Just so you can look at the city's website, www.somervillema.gov, and you can follow the links and explains our phased reopening plan. I presented it on this town hall tonight, and it lists those that are still on hold and those businesses and sectors that are activated. And we'll be providing further update in the next several days, as well as organize a meeting with the different sectors, houses of worship, personal services, businesses, and so forth. So thanks for the question, and please stay. There's another question around contractors. When can I start my contractor outside my porch to fix my outside porches that need to be replaced? Again, this is probably June 1st, but you should check with the Inspectional Services Division. One, in addition to your permit, you will need to file a job hazard analysis and site safety plan. Please get that going now so that when you're able to actually do this on that date, you're well prepared. You can call 311 or look at the city's website, www.somervillema.gov/coronavirus, or send an email to the Inspectional Services Division. Thank you. We're gonna go back to the Q&A portal. So this is from Vivian Shu. Is our testing exclusively for Somerville residents only, Doug?
We are doing the testing, but as the mayor mentioned earlier, a variety of communities around us are also doing the similar testing. But the testing we're doing here, yes, that is for Somerville residents.
For folks who are tested at the Cambridge Health Alliance, what number can they call to obtain their test results? Doug?
Thank you. We will post that. That's actually on the sheet that you will get, but we will post that on the chat so everybody has that and they don't have to quick run and get a phone or a pen.
Here's a question from Kay McGowan. Does Somerville have any resources to share with businesses for purchasing supplies, gloves, hand sanitizer, disposable masks, et cetera, or a plan to help? That's something we're analyzing and researching now, and working with the state and other leaders as well. That's one of the questions I got from one of the business owners who said, I'm not going to be able to meet the PPE requirement of this. So yeah, hey, we're developing that plan, and part of the conversation we're going to have with you is understand what are you going to be challenged with? What will be difficult for you to be in compliance with? So Kate, thanks for the question. Stay tuned. We'll be having conversations and making announcements soon. Here's an anonymous question. What do we do if we see groups congregating and not following social distancing guidelines? For example, every Friday I see a group of teenagers congregating on our street. From this anonymous person, you can call the police department's business line, 617-625-1600, or just call 311. 311, submit your information. We'll make sure we'll go out there and talk to them, educate them. We'll use compassionate community policing. We want people to be educated, to comply, and we will not be punitive in this approach. Thank you for the question. Please reach out to us. We're happy to go out and engage with those folks. Here's a question from Bonnie Cohen. Looking ahead towards summer, what are your thoughts about splash parks and public pools? Have you considered opening pools with decreased capacity, perhaps rotating people through every 1 or 2 hours? Or do you have any other thoughts about how residents will be able to safely cool off in the city? Bonnie, thank you. This is an important question. I was really irritated by the state opening up golf courses. Now, I understand you can meet the operational challenge by virtue of space, but in terms of doing so without even gazing through the equity lens was really troubling. and I made that clear to state leaders. We don't have a golf course in Somerville, and many of our community look at those pools across McGrath Highway from the east side of the city, and that's near Nantucket and Martha's Vineyard, and they wonder, will I be able to seek some relaxing solace or relief during the hot days? As well as, you know, I have a problem that led with golf courses first when not thinking about fields and recreation spaces and how we could provide programs for kids and families and access to those programs in a safe manner. So we are thinking about this locally, Bonnie, and I have Jill Latham chime in. We're also been in contact with the Commonwealth and understanding that there'll be guidance coming for this for phase 2. I'm going to hand this off to Jill Latham. Jill?
Yes. Hi, Bonnie. Yes, we're definitely looking at particularly how we open up the Dilboy pool, and definitely looking at whether that be how we social distance with the deck and social distance in locker rooms and in the area to come in as you enter the pool. There's definitely ways to safely manage aquatic facilities throughout this pandemic area with social distancing, and we are very excited to implement this here in Somerville.
Thanks, Jill. From an anonymous attendee, how will you ensure schools remain fully funded without cuts to staff? Thank you for the question. What's not being talked enough is the looming fiscal crisis to cities and towns. Unlike the Great Recession between 2008 and 2010, when the economy slowed and leveled off and sectors of the economy were peeled back, what we're faced with today is a complete stoppage, an abrupt halt in many sectors of our economy. That has caused incredible stress on state revenues and will put incredible pressures on city, local budgets and school district budgets. Right now, the Commonwealth is projecting anywhere from a 20 to 25% loss in revenue for the next fiscal year, which begins July 1. The city of Somerville is looking at, right now, at the moment, it could change probably for the worse, a loss of $12 million in revenue between state aid, which represents about $7 million or more, and other sectors of the economy, like restaurants and so forth, where many of them aren't just going to start right up and aren't active at the moment. It's not clear to what extent they would become active. We need to take the same informed analytical approach we have for the past 17 years under my administration to make sure we utilize our fiscal acumen and our priorities and values to make sure that we do not dismantle or disintegrate the very framework and foundation of our essential programs, what we built up in the schools in this case. So we will be guided by our community values. There's going to be some pain. We will use our resources that we built up the years, including our stabilization funds and free cash allotment to backstop a lot of the city's efforts to make sure we can continue to, one, keep people in the jobs where we need them to deliver these services and not turn back the clock in the advancements we made in public health, public education, public safety. So there's more to come on that. We'll be working closely, and I'm working closely with the City Council. I'm leading a regional effort with city and town leaders with the Commonwealth at a time when we know there's not going to be a lot of cash coming to cities and towns across the country unless the Republican-led Senate and Congress, Senate, has a change of heart. We need a bailout just as much as the airline industries and other big business and corporations do. More than 20 million people work in the public sectors across this nation, and cuts to that staffing, reduction into those critical services will only deepen and broaden and make it for a more painful economic downturn. We are very much tuned into this. There's going to be some pain. We're going to make sure that we do everything we can that those decisions, again, don't turn back the clock in all the gains we had. So I thank you, and especially in schools, and I thank you. And there'll be a lot of opportunity for you to participate in public discussion on this. This question is from Kenya. Kenya, great question. It's from YouTube, live from Kenya. Thanks, Kenya, for submitting on behalf of someone. Are masks available for female faces? I noticed the blue disposable ones given out by Somerville are a bit large and fit males better than females. Great question, and something we should pay probably closer attention to. Omar or someone, or Jill, can you answer this?
And yes, and getting the suppliers from the masks, unfortunately right now, with the supply chain, the masks are pretty much a standard size currently, but we can definitely look into if there's any possibilities coming on the pike for smaller masks. I know that there's smaller youth size masks that may work, but I can definitely look into that.
Thanks, Jill. I have a shop on a corner, it's an anonymous attendee, with a good deal of street activity. I gave a stack of disposable masks to an elderly man the other day. Once open, would you consider providing local shops a supply to hand out as needed with discretion? Jill or Omar, someone to answer about our mass distribution plan. Great question. Thank you for the question.
It's currently mass distribution. We have kind of a set standard with the police handing them out and the immigrant services handing them out. I think there's definitely room for us to kind of discuss how can we get more masks out to businesses and what that process would look like. So I think it's definitely something we can discuss and kind of process and move forward with how we can make that happen.
Just to add to that, Mayor, like the Mayor mentioned, we're working with the state in order to figure out how we can create a predictable marketplace that allows folks to have access to the proper PPE so they're not counterfeit and there is no price gouging. That applies for us too. So if we get more masks and the same ability that we've been able to get them until now, we'll make sure to provide them accordingly to our business owners.
Here's a question I'll answer. It's directed at me. Mayor, you seem to have no problem receiving a haircut on a regular basis. Where's the fairness in that? Hey, if you think my hair looks great, thanks. If you get up close, it's pretty frightening. And I think if you look at the panel, you know who's cutting their own hair. We need to get you a salon just as bad as you. I feel for you. I hear for you. I would love to get a haircut from my hairstylist. But we'll do so when it's all safe. Thanks for the question anyhow. So here's we have about 4 more minutes left. Again, we will get through as many of these questions as possible. And then the questions we don't answer this evening will be answered online at somervillema.gov/virtual town hall. From another anonymous question is, have you looked at new data coming from Italy and autopsies suggesting that this is a cardiovascular disease and not a respiratory one? Also, can you point to a past experience from anywhere in the world that suggests that shutting down the economy for respiratory disease has shown any positive results? So let me first answer. This confuses the pandemic with the interventions. It's not the interventions that have shut down the economy, it's the pandemic. And there can be no economic recovery without a healthy society. We need to make that clear. So we didn't shut down the economy to deal with the pandemic. We've collectively made sacrifices in how we interact with one another because this disease really depends on our ability to avoid other people, to interrupt the transmission of the virus. Those interventions to respond to the pandemic, the pandemic have had a consequence on our economy. That is true. I'm not a medical professional and cannot speak to the distinguishing whether it's a cardiovascular or a respiratory disease or impact. I think there's still a lot that's going to be written in how this pathogen moves or evolves. I don't know if Doug or Omar want to comment further on that.
I'll follow Doug if you want to add to it.
Sure. Thanks for the question.
You're muted.
All set.
I think, can you hear me now? Okay. I think my computer is starting to fight back with me and not always unmuting when we like. We are learning more about this virus every single day. It's something new and we are learning about it, and more will be coming out around some of the medical responses that we've been seeing, the implications of getting the virus and what will happen to your body. Everybody's acting a little bit differently. Yes, anybody who has an underlying condition, it's those underlying conditions that start to take over and will often cause the fatalities that we're seeing in these individuals. So it's an opportunistic type of a thing that's actually taking on a different kind of a spread within the body itself. So keep your eyes open. There's all kinds of research that's out there. We are going to learn more and more about this particular virus and how it's impacting the body every single day. Let's again think about how we're slowing the spread of this virus. And yes, it is impacting and having a huge impact on our elderly population. We need to make sure that we protect our vulnerable communities. I couldn't imagine knowing that if I was out there not being careful of how I was responding, what I was doing, and I got infected with the virus and I ended up infecting one of my parents or grandparents. The devastation that I would feel and the guilt that I would feel within that is horrible. So I think that's why we have to think about this as an entire community response. This isn't just for one person. We have to think about this as a community response.
Thanks, Doug. I'm going to take 5 more questions. 2 of them can be combined into one because they're very similar. And that'll be these first 2. Are you relaxing the community gardening rules? And along with that, right now, only 1 person at a time is allowed in the community garden. Do you foresee this policy changing in the near future? Perhaps Brad, you can answer it, or Omar?
Happy to, Mayor. So our approach is to make sure that we mitigate as much risk as possible through our guidelines and rules. And so the thought behind that is to make sure that only 1 individual is in that space at a time. Folks can forget that they may be around another community gardener. They may forget that they don't have their mask while they're on their knees gardening. We want to make sure that we have measures in place that mitigate risk regardless of people's attention or how they feel at the time. Now, as the data becomes better and as we have a sense of better security, that folks feel a little more comfortable in terms of compliance, that may be something that we could look at and consider.
Thanks, Omar. Here's a few more questions here. Will the 311 app be updated to include COVID-related concerns? For example, seeing groups congregating in the streets or folks running around without masks? Omar? Can you hear it? Let me repeat that again. Will the 311 app be updated to include COVID-related concerns? For example, seeing groups congregating in the streets or folks running around without masks, etc.
Thank you, Mayor. Yes, we're looking at our digital infrastructure in general. I think now that we have been able to go through the surge and hopefully the trend continues to show positive results, we will have more of an ability to readjust from a holistic standpoint in the way we approach our customer service. But that's definitely on the to-do list in terms of things that we need to evaluate and update. So hopefully more to come soon.
Brad, I'm going to combine these 2 questions for you. One, is the Shared Streets Initiative meant to be temporary or potentially permanent? And the second one is, does a city have plans to expedite needed roadway improvements like protected bike lanes and bus-only lanes?
Sure, Mayor. So, saying good night to my 4.5-year-old here. It's a great question. Many of the routes that our team has selected, as we've mentioned, are routes that we have long-standing community concerns about travel speeds, about safety for people walking, for people rolling, for people on bikes. And so one of the things that we have had great success with in Somerville is demonstrating the value of slow streets, traffic calming, and pedestrian and bicycle improvements using temporary materials like paint, like plastic flexible bollards. And then if we measure the success, transitioning those interventions into more permanent materials, concrete, granite curbs, asphalt speed humps. And I think that this will function as a bit of an experiment for us. And with public safety benefit shown and with constituent quality of life improved, many of these types of interventions would be good candidates for longer term conversion. I hope that answers the question.
I think the shared streets, is that temporary or permanent was the other question.
We're viewing this as temporary for now, Mayor, because we're using movable equipment. But again, it will demonstrate the value of slower streets for all of our residents.
Yeah, we have 1 question and 1 comment left. Regarding the fiscal gap, this is from an anonymous person. The question, thank you for the question. Is the city considering other mini bond issuance or similar for residents to be able to contribute? More to come on this. Thank you for the question and appreciate you inquiring about that. That was a success. We have we're considering a lot of legislative tools and tools that we normally don't have at disposal. That's one we've utilized before. We'll update you more as we think about how we formulate our plan to close any budget gap. So more to come on this, and thank you for the question. It gives us something to think about. Finally, from an anonymous attendee, thank you for this. We greatly appreciate and strongly support all of the measures the Somerville administration is pursuing to reopen smartly slowly and cautiously. We thank all the city employees for their hard work to keep our city healthy and safe. We feel incredibly grateful to be living in Somerville during the crisis and all other times as well. Thank you. We thank you for that comment, and I also want to give a big shout out to the city staff. Not only those on the call today, the DPW workers on the front line delivering essential services. Our first responders, fire, police, who are the first to respond to any call. Our nurses, everyone working in our Health and Human Services division. Our teachers and staff and volunteers in the Somerville Public Schools, making sure our kids continue to learn and families are being fed, and all of you who have volunteered. It's our honor and privilege to serve you. I know I didn't get to all your questions. I believe we answered 55 on the Q&A function, and actually almost as well as about 20 on those submitted. However, again, if we didn't answer your question, we're going to go through everything we answered, reconcile that against what has been asked previous to the meeting and on the Q&A function, and we'll post those answers at somerville.ma.gov/virtual-town-hall. We plan to have more meetings with all of you like this to keep you informed. We will strive to continue to be transparent and accountable and upfront and ethical with what we're dealing with. I think that's what we need to be, with you, brutally honest. And we're all of this together. We recognize and are acutely aware that many of you have sacrificed your livelihoods, your jobs, people in your family. You're struggling to support one another. I think we all are also acutely aware that people are sick in our community. More than 23 people have lost their lives. That's something that strikes home. And it's something that we're aware of every day, and we'll continue to roll up our sleeves and work 24/7 for all of you in the entire community to make sure that as we move forward, we're doing everything we can to make sure that everyone is healthy and safe, and that we're especially paying attention to our most vulnerable populations. And as we continue to try to reopen sectors of our society and our economy, we do so in a very respectful, equitable, and sustainable way. Thank you for joining us tonight. I appreciate all that you do. Thank you for your flexibility and contributions and efforts to help us overcome this unprecedented crisis. Thank you for our panelists and folks. We look forward to our future meetings with all of you. God bless.